Hello, hello, everyone. I am Dia Walker, and today I am going to be talking about the Walker method. So I'm super excited to deliver that information to you guys. We're streaming live on YouTube as well, and I have a PowerPoint presentation all prepared. So if anybody has any questions, please put them in the chat box, or you can go ahead and ask questions on YouTube as well. So recording on this and looking forward to answering any of your questions regarding the Walker method. So I'm going to go ahead and share my screen and go and get started. So right now we are kind of working into the total body renovation portion of Correcticise. So like the house that was broken down, or like the car that was broken down as well, our bodies will need a renovation at some point in time because it's the only body that we're going to get. We can trade in cars, we can sell them. We can't sell our body, hopefully not, but that was a bad choice of words. But we can't just get a new body, right? We need to kind of do a renovation periodically and then maintenance, right? Just like a car or a house. I don't know why people think any differently, that they can expect to walk 10,000 steps on their body every day of their lives and have no negative problems of that, over time when you get older and older, without taking the proper steps, excuse the pun, to undo that wear and tear and make sure that you are aligned on a proper sound body that you can sustain that kind of intensity throughout your life. So I hope you're getting an understanding of that. To reach out to me, you can do any one of the following. It's fixyouonline.com, Fix You Online TV on YouTube, and the Fix You Online Facebook group. So I'm going to go over a little bit about what we talked about yesterday. So we talked over the last few days. The alignment is the key for balance. We talked about that, right? Because it is about keeping our center of gravity over our base of support, just like this rock, okay? And it's also the key for energy, because if we are not in the best alignment, we're actually using more energy. We're expending more energy. And it's also the key to injury prevention and career longevity, or I should say activity longevity. So here again, Roger Federer, 39 years old, Pete Sampras now at an older age. This is after he retired, of course, but look at the degeneration in Pete Sampras's body. And when both of these guys are probably 70 or 80, as long as Roger doesn't go to hell with himself, he will likely maintain a good quality of life, where Sampras, even though he was ranked #1 in the world as a tennis player at a young age, he is likely going to have some significant problems, particularly with his shoulders, his back, and his neck as he gets older. I mean, look at we talked about function, frequency, and flow with regard to alignment. Okay, so look at Pete's carotid artery, right? So that's feeding his brain. Look at how it goes from here, it's going in and then up, right? Whereas Roger is definitely more aligned. Who's going to have better blood flow to the brain? So what causes malalignments in the body? We went through this yesterday. So if you have sustained or have gone through any of these, and I think we all have been in utero, so we have, if you have had any kind of trauma, if you have been pregnant, if you were birthed, if you have habitual patterns that you have been using in your life, like let's say you're a golfer, right? You're always rotating to your one side to golf. If you are sitting for a prolonged period of time, either because of work or that is your leisure activity, Netflix is your sport, then that is an issue, as well as any sort of immobilization at any time. And actually should also include on this compensatory problems. So if you've ever had an injury or an ouch or an ache or pain, what will happen is that you will compensate by changing your walking pattern or adjusting the way that you're moving to avoid that painful range of motion. So this happened to me when I was kickboxing and I avulsed my toenail. My toenail came off when I kicked the pad. And so for several months, they wound up having to take off the toenail. And obviously it was tender because it was raw skin. And my gait pattern actually changed. I wound up not putting enough weight on my big toe. And several years later, because I never undid that pattern, I came very, very close to having to have knee surgery because I injured my knee. So that would be another factor. So if any of you have gone through any of these, there is a good chance that you need to do the Walker method. So again, if you've experienced one of those, you are functioning on a certain degree of malaligned body. Now, some of us are closer to the Mercedes than we are to the VW, but for many of us, we are at some point in time in between these two. And the idea is to get back to the renovated condition, not the close to the junkyard. So we talked about when you're not in alignment, and most of us are not, that it will dictate function. So that's because of the length tension ratio, stating that a muscle will contract with greatest strength when it's at a particular length. If it's too long or too short, it's not going to work properly. Our muscles attached to our bones via tendons, and if any of those are restricted, then again, we are not going to be able to function properly. If we're in an altered posture, we are not going to be able to function optimally. Secondly, frequency. So we talked about the nervous system, we talked about the electromagnetic field, we talked about energetic medicine and emotions with regard to alignment. And lastly, we talked about circulation and conduction, which is the flow of either nervous stimuli through the circuits in the body, the nervous tissue, or more theoretically, with regard to digestion, like we illustrated yesterday, breathing, like we also demonstrated yesterday, as well as blood flow. So you could even look at alignment with regard to conception, for example. So when women conceive, obviously there's a tube that the egg has to go through. What happens if that tube is kinked? Well, that might cause an ectopic pregnancy. That's where the egg, the fertilized egg, becomes attached to the fallopian tube. So again, alignment, think about your digestion. If there's a kink in your intestines, are you going to be able to adequately digest your food or gain nutrition? Again, I mentioned earlier, I think alignment is probably one of the most underrated aspects of health and well-being right now in our current medical and even wellness field. All right, so here, yay, the Walker method. So it is consists of 3 steps. So the goal, again, realign. Now notice, realign is not the first step, because many of us, when we are in habitual patterns, when we sustain trauma, what happens to our connective tissue is it becomes adhered and it becomes deformed. And the connective tissue has these little kind of latch points in the muscles in particular, and they get stuck. So like today, I just walked, I went walking with a friend for 7 miles and then got in the car and just drove not long, maybe like 15, 20 minutes. When I got out of the car, I was kind of hobbling a little bit, right? That is the connective tissue kind of changing very rapidly into a certain position. And again, over time, that's like when you take a long trip on an airplane, you get up and it's kind of daunting, whereas younger people don't really have that problem. So what winds up happening is that we need to first, and this is where 98 to 99% of exercise programs, of therapy programs, of treatment methods that are available to the general public do not address, and that is release. Okay, you need to release the connective tissue that's holding the body in the posture that it's in, and then you can realign. We have realignment tools down the wazoo. It's bracing. It could be taping, bracing, any sort of device that's going to put you in a certain position is realignment. And then there is, once we're in the proper alignment, then is reinforcing that proper alignment to retrain the nervous system as well as the muscles on how to move and recruit properly. Because when you're not in alignment, guess what? You're not recruiting properly. If you don't know how, and you're in alignment, you're not going to recruit properly. So there needs to be a knowledge here. That's where the empowerment comes from, is having the knowledge on how to reinforce this, this realignment that you are now able to achieve because you've done the steps. So that is the Walker method in a nutshell, and I'll get into it further in our next session. So again, I had mentioned the goal is alignment, but if you are aligned and you don't know how to recruit your muscles properly, then you need to have that knowledge. If you are aligned but you don't know how to stand properly, you're just going to go back into malalignment. If you're aligned and then you go and sit for 20 hours improperly, or you become immobilized from an illness, it's not going to work properly. So even though you're aligned, you need to definitely have an understanding on how to reinforce. And hopefully what happens is that life becomes your exercise. Because if you are aligned properly and you have an understanding about proper walking technique, every step that you take is a abdominal exercise, is a glute exercise, is a hip extension movement exercise. It is a back stabilization exercise, obviously a breathing exercise. It's an ankle exercise. It's even a toe exercise. So you're getting all of those things when you are aligned and when you're doing something properly. Now, I had mentioned before, we cannot achieve ideal alignment without release. In my opinion, you cannot, and I'll tell you why. For some areas of the body, I would say maybe, and I would consider areas such as the forearm, maybe the thigh, but very, very few areas would I say that you could achieve ideal alignment without release. I mean, and that's because they are big areas that perhaps could be achieve normal range of motion and alignment without release. But for these very small joints, and I'm going to go back onto the screen for a second. For the very small joints in the toes, in the foot, you're just not going to be able to exercise these individual joints in a manner that is going to allow them normal mobility without releasing. I can't think of a way that is possible. And if it is, it would take years. It would take absolutely years, because I can give you a very good example of a realignment strategy that is done on individuals at 24/7, and it takes years, and that's your teeth. Okay, so children or adults even who get braces will go ahead and they will be realigned for an extended period of time, 24/7. So, and how long does it take to align teeth for braces? At least 2 years. And those tend to be prepubescent, so they tend to be more malleable. So that is how long it would take 24/7 to achieve realignment. But if you can release somebody and put them back in the alignment and then teach them how to stay there, that's pretty incredible. And I'm going to show you some pictures of people that I've worked on, or people that have worked on themselves, and show you that it is possible to go ahead and release and realign even some pretty altered postures. All right, so I'm going to go back to screen share. Okay. So going on, why are traditional release modalities, right? So there's basically massage, chiropractic, and manual therapy are the three that I can think of. And even those, in my opinion, sometimes do things wrong for certain areas of the body, which I shouldn't say wrong. They do them inefficiently. Okay, so it takes a lot longer. And obviously, you know, I'm all about optimization, not only of your functioning, but of your time, right? How much time do you want to invest in doing this? So here's an example of something that's a wrong releasing tool. And this is the foot skeleton for the foot. And what you see here is that you see that there is a ball, okay, underneath the foot. And many people use a bigger ball than this. This is a fairly small super ball. And the joints are so small that that ball will cover 3 of them. And so you're not able to get specifically in between the bones of the foot or the smaller areas, particularly the cranium, the head, as well as the hands. So you're just not able to get into those areas using a large releasing tool. So a lot of people use a foam roller. I'm not saying a foam roller is bad. It's just not optimal. Okay. And because it's a very large releasing tool. And the second thing is that they tend to rub, you know, they go over it and they don't stay on one point. So that's what we're talking about. They take too long. So, you know, to massage a quote unquote knot within this muscle right here from the massage therapist, you know, could take minutes at least, maybe, you know, maybe even the full hour, not even get it. And because it's such a big releasing tool, the hands, they could be missing some connective tissue restrictions that exist because they're using their whole hand rather than pinpointing it with a fingertip. So, or a small area. So small is more specific when it comes to release. And then the biggest concern is with regard to physical therapy in particular, is that you want to have carryover. You want your patients to come back in better than they were when they left you the last time. And not even the same, you want them even better. And you want to get them better over time. And a lot of times these modalities, either they have to be done very frequently, and because, you know, they don't have the knowledge on how to, or maybe the reinforcement of taping, for example, for realignment. And then they certainly don't know how to reinforce it with proper posture and movement, which again is not emphasized enough with regard to patient population. Even myself as a physical therapist with, at the time, probably, you know, 5 years experience, when I went to class, I realized that my posture that I thought was great was not. So again, that is going to be something that is emphasized in the Correcticise program that is not available in other modalities. So, you know, here's some examples of when release is done properly. So this was actually after treatment on the 31st of March. And then she was not touched between the 31st and March and April 14th, right? Nor was she actually realigned because I did not tape her, but there was continued improvement, right? So when you align the foot in particular, every step you take is reinforcing. So again, there's not a lot of need to teach proper use of the foot or standing weight of the foot. So it's actually very simple. But then once you get it, every step that you take is then an exercise because you're in the proper alignment. Just like, you know, if you're in the proper alignment with regard to abdominal exercise and all of those other things I mentioned earlier. So here's another example when it's done properly. This was before treatment. So this was somebody who flew in to see me from Houston, and she is a tennis pro, 6 surgeries on that knee. the one that I actually fixed. But not a 7th, okay, because we dealt with her problem. So if you see here, her weight bearing, and she happens to have a bunion. This is a clear example of a walking bunion, where the weight of the knee comes onto the inside of the foot. And what winds up happening is that there's a lot of pressure here on that first metatarsal phalangeal joint, the bunion joint, and therefore it gets reinforced with every step this person takes. So if this person had bunion surgery, this is probably where there's a 5 to 10% failure rate, is because the problem is actually in the leg. It's not in the foot where they correct. They realign, okay? But they never release. Well, they might release with scalpels, but they're not releasing the right things because the problem's in the leg and the thigh. So this was after the first session. And then this was several months later and after the second session. So she never went back. She never went back to this. And I haven't seen her, so dollars to donuts, she's probably doing great and doesn't need to see me anymore. So there's a misconception that there's nothing you can do to change your posture. And that is incorrect. I mentioned this before, because the posture of the body is dictated by connective tissue, not bone. A bone is the type of connective tissue, but it's like if you debone if you take the bone out of a steak, it doesn't change the form of the steak. The steak doesn't, go into water. If you debone a fish, same thing, right? That it maintains form. It's the same thing in the human body. So again, if you remove the skeleton of a human body, the form would not change. It's the connective tissue that is malleable and can be altered. And then the second misconception is that you can't do this yourself. And that's also wrong, because if you are able to access an area, feel discomfort, and move, then you can release, or at least do the release that I teach. So here's somebody who did some release on themselves. And again, a pretty significant bunion, a real rotation of the big toe. And then you look at her after, while there's still a bunion, the angle is less significant and there's less rotation of the toe. This is a better alignment. Not perfect, obviously, but much more functional and not progressing, certainly, than this one. So there's 2 release techniques that I teach, and one is called the comprehensive core release, and the other one is called rotational release. And I'll go through the comprehensive core release with you, but basically it takes about 10 seconds to complete, which is great. So you're not spending minutes or hours. It's optimal, right? It's quick. And then it also allows for good carryover because it's very targeted. And, when I actually train therapists, I teach them how to really determine exactly where to release. And I'll give you some clues on that as well. So I will go ahead and take you through the comprehensive core release technique. And what that looks like is, and we're gonna do our neck. And it's interesting because I'm standing straight and it looks like my neck is tilted. So it should be like more there, but I'm not going to do that area. But what I'm going to show you is we're going to look at rotation. That's pretty easy. So again, we have vertebrae that start in our neck at 1, 2, 3, 4, 5, 6, 7. T1, 2, 3 are in charge of rotation. And so what we're going to do is you can look to your right as far as you can, and then look to your left as far as you can. And what you want to do is you want to feel not only how far can you look without moving, right? We want to keep our shoulders stationary, but also how does it feel? Now, I'm actually feeling more of a problem when I turn to my left, and I actually think that I'm side bending a little bit. And I can actually feel where that is, and maybe that's the reason my head is crooked. So what I'm going to do is I'm going to encourage you to go ahead and find or tune in to the spot where you might feel tightness or a lack of quality, easy movement. And once you find that, you're just going to take your finger, and I'm going to just show it to you on my face because it's going to be difficult for you to see. But let's just say this is my spine, and I'm going to go ahead and depress, and I'm going to feel if it's tender. Now, you can just go ahead and feel for tenderness down every segment, every vertebra of your spine. You can go ahead and do that. That's very easy, okay? But once you find a tender spot, what you're going to do is you're going to depress in about 80%. You're going to maintain that position, and then you are going to go around an imaginary clock. And don't let up. You maintain the depression and go around the imaginary clock until you find the direction that is most tender. So again, you go in, 80% force. You maintain that force. Don't pull out. Go ahead and stay in. Then you, as you're depressing inward, you're going to go up to 12, around to 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. And you're going to find the direction that is most tender. So here I am, and let's just say 12 is most tender. So I'm going to keep it on 12 o'clock, right? And then what I'll do is I will either press the flat part of my tongue on the roof of my mouth, or I'll take another hand and go in a diagonal. And what I'll do is I'll pull down and away or up and away and find which direction decreases that tenderness. Now we decrease, and then all I need to do is move. So I can move 10 times this way. I can move 10 times this way. I can move 10 times this way. And that's it. So I want you to go ahead and find your spot. Go ahead or go around your imaginary clock. Find the direction that's most tender. And then stabilize by depressing your hands into your tissue and then going in a diagonal direction away or an upward direction and a diagonal also. Find the one that moves less and then move 10 times. And that's it. So now you can go ahead and look one way and look the other way. And I don't know about you guys, but for me, I actually felt a difference. So the good news about the comprehensive core release technique is that it can be done on any part of the body. So I just did it on my cheek. You can do it on your nose, you can do it on your forehead, you can do it on your scalp, you can do it anywhere. And it only takes 10 seconds to do. The bad news is that usually it is exquisitely tender and painful, particularly when you get into connective tissue that does not get touched often, in the foot, in the hands, and rib cage in particular, and sometimes the jaw. So tomorrow, I'm going to go through the second two areas of the Walker method, which are realignment and reinforcement, and talk a little bit more about how we go ahead and maintain carryover and make life our exercise. So have a good night, everyone. I'll see you tomorrow live at 5, and ciao for now. If there are no questions, sorry. I forgot to ask if there are questions, so I will go ahead and look if there are questions on YouTube. Sorry. Let's see. Okay. Nope, no questions. So I will go ahead and say goodbye for now. Ciao.